The following data is from the HSE here in Ireland, Epidemiology of COVID-19 in Ireland, report prepared by HPSC on 4th of September 2020 for National Public Health Emergency Team. Page 11, Table 7, Summary of deaths in all COVID-19 cases notified in Ireland up to midnight, 2nd of September 2020. Total number of deaths, 1,777. Cases admitted to ICU, 94. Number with underlying clinical conditions, 1,677. Median age, 84. So, COVID-19 is apparently so unbelievably deadly that you have to be extremely old and or already have underlying conditions or multiple morbidities in order to die from it. When an elderly terminal cancer patient is in hospital fighting a long-term battle with cancer, it's true that they can pick up other illnesses in the hospital given their weakened state, like pneumonia or the flu, for example. But when the death cert is written, it's clear that their cancer was the primary cause and the pneumonia was either something they picked up or something that may have pushed them over the edge. Nothing changes the fact that they didn't die specifically from pneumonia, but they are still first and foremost a cancer victim, and an elderly one at that. Cancer will be the primary cause of death on the death certificate. But this is not the way things are being managed under COVID-19. Deaths with COVID-19 are considered to be basically the same as deaths from COVID-19. To make matters worse, a PCR swab test mostly finds existing coronaviruses or even antibodies to COVID-19. So the fatality data alone does not tell us if COVID-19 actually made a person sick. It doesn't tell us if they had symptoms from the virus itself. It doesn't tell us if the virus led to their hospitalization. This is why we have a case-demic at present and not a pandemic. More testing equals more cases, but the death rate is on the floor right now. Given the way that COVID-19 death certification works, a doctor doesn't even need to test for it in order to diagnose someone as having died from it. This means that, as some of us have known since April, COVID-19 can be placed on a death cert as a suspected factor in their death. In Ireland, we were told that the total number of deaths from COVID-19 is 1,777. If you subtract this figure from the number of people who died with COVID-19, 1,677, the total number of deaths specifically from COVID-19 alone is just 100. Just 100 people died specifically from COVID-19 in Ireland thus far. 100 people in 6 months out of a population of 5 million. Now, every life lost is a tragedy to those families, of course. But to shut down the country and destroy our society, producing more state welfare dependency and massively increasing suicides and delaying cancer patient treatments, it's simply not justified. More people are going to die from the lockdown measures than the virus, clearly. The median age of death for COVID-19 in Ireland is 84. The average life expectancy in Ireland is 82. Let that sink in for a moment. One death has taken place under the age of 25, which was a 17-year-old with underlying conditions. Thus far, only 758 people have been hospitalized and just 94 admitted to ICU. That 17-year-old is the youngest person to die from COVID-19. COVID-19 is so unbelievably weak as a virus that it needs someone to already be extremely ill, or, in most cases, over the age of average life expectancy in order to kill them. What's more, of the 1,677 people who died with COVID-19, there is no breakdown of the primary cause of death for those people. We have no idea if they were actually symptomatic from COVID-19, because, as I said, testing is either A, not required and can be diagnosed at a doctor's discretion, or B, is finding antibodies for other coronaviruses that people already have, or C, is finding immunity to COVID-19. According to this report, for the 2-week period between the 24th of August to the 6th of September, there have been 0 deaths from COVID-19 in Ireland and just 1 ICU admission. There is serious talk at present of both Dublin and Limerick being placed into lockdown again because of a growing number of cases. The public has simply outsourced their critical faculties and are not asking the question, how many people who tested positive for COVID-19 have symptoms? How many are hospitalized? How many have died? Are they in fact completely healthy people? People have to wake up soon. They're simply not being exposed to the true data, and they are not exercising critical reasoning skills. According to data from the Central Statistics Office for deaths in Ireland for the first 5 months of 2020, there appears to be nothing out of the ordinary when compared to previous years. So, where was the alleged pandemic? I should point out, once again, that similar guidance on classifying death certificates has been given to other countries. For example, in the UK, they have this document, Guidance for Doctors Completing Medical Certificates of Cause of Death in England and Wales. On page 4 it says, 4. How to complete the cause of death section. COVID-19 is an acceptable direct or underlying cause of death for the purposes of completing the medical certificate of cause of death. COVID-19 is not a reason on its own to refer a death to a coroner under the Coroners and Justice Act 2009. That COVID-19 is a notifiable disease under the Health Protection Notification Regulations 2010 does not mean referral to a coroner is required by virtue of its notifiable status. Medical practitioners are required to certify causes of death to the best of their knowledge and belief without diagnostic proof. If appropriate and to avoid delay, medical practitioners can circle to in the MCCD information from post-mortem may be available later, or tick box B on the reverse of the MCCD for anti-mortem investigations. For example, if before death the patient had symptoms typical of COVID-19 infection, but the test result has not been received, it would be satisfactory to give COVID-19 as the cause of death. Tick box B and then share the test result when it becomes available. In the circumstances of there being no swab, it is satisfactory to apply clinical judgment. In the US, there's this document, the National Vital Statistics System. Should COVID-19 be reported on the death certificate only with a confirmed test? COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc. If the decedent had other chronic conditions such as COPD or asthma that may have also contributed, these conditions can be reported in Part 2. Presumably, this kind of policy with respect to the certification of death certificates for COVID-19 is also being enacted in the majority of countries. Anyway, the next little clip that I want to show you is from Jerry Day, and I think this explains the situation with the manipulated PCR testing and how it's contributing to the case-demic.
I'm going to read to you an article published by Global Research on March 27th, 2020. The link to that article is in the notes below this video. This article, posted by author Julian Rose, is basically a copy-paste of a presentation from a medical forum. The original presenter, identified as a widely respected professional scientist in the U.S., prefers to stay anonymous because presenting any facts or information which may be contrary to official narratives can cause negative consequences for any medical professional who discloses that information. I have edited the article for clarity without changing its meaning or implications. And I quote, I work in the healthcare field. Here's the problem. We are testing people for general coronavirus, but we are not testing for any specific strain, such as COVID-19. There are no reliable tests for any specific COVID-19 virus. There are no reliable agencies or media outlets for reporting numbers of actual COVID-19 virus cases. Coronavirus are incredibly common. A large percentage of the world human population will have COVID DNA in them, small quantities, even if they are perfectly well or sick with some other pathogen. So the implications are quite clear. If you want to create a totally false panic about a totally false pandemic, pick a coronavirus. They are incredibly common and have many different varieties. A very high percentage of people who have become sick by other means like flu or bacterial pneumonia, many other causes, will have a positive PCR test for COVID, even if you're doing the test properly and ruling out contamination, simply because COVIDs are so common. There are hundreds of thousands of flu and pneumonia victims in hospitals throughout the world at any one time. To create a false claim of pandemic, all you need to do is select the sickest of these in a single location, say Wuhan, administer PCR tests to them, and claim those few people showing viral sequences similar to a coronavirus are suffering from a presumed new disease. Since you are already selected the sickest flu cases a fairly high proportion of your sample will go on to die. You can then say that this new virus has a case fatality ratio higher than the flu, and use this to infuse more concern and do more tests, which will, of course, produce more false cases, which expands the testing, produces yet more false cases, so on, so on, so on. Before long, you have your pandemic. Totally fabricated. All you've done is use a single test kit trick to convert the worst flu and pneumonia cases into something new that doesn't actually exist. Now just run the same scam in other countries. Make sure to keep the fear message running high so people will feel panicky and less able to think critically. Your only problem is going to be that because there's no actual new deadly pathogen, but just regular sick people, you are mislabeling your case numbers and especially your deaths. So your actual deaths attributable to coronavirus are going to be way too low for a real new deadly virus pandemic. But they are preventing people from pointing this out in several ways. First, they claim this is just the beginning and more deaths are imminent. They use this as an excuse to quarantine everyone and then claim the quarantine prevented the expected millions of dead. Second, they tell people that minimizing or downplaying the dangers is irresponsible and bully people into not talking about the real numbers. Third, they talk nonsense about made-up numbers, hoping to blind people with pseudoscience. And then fourth, they start testing well people, who of course will also likely have shreds of coronavirus DNA in them, and thereby inflate the statistics with people with no symptoms. Then they spin that to sound deadly, even though any virologist knows the more symptomless cases you have, the less deadly is your pathogen. Take those 4 simple steps, and you can have your own entirely manufactured pandemic up and running in weeks.
Let's move on now and talk about policies with respect to face masks. Remember when the World Health Organization previously said the following a few months ago?
Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other preventive measures. WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks because there is no evidence that they protect people who are not sick.
And Dr. Fauci even said this.
Right now in the United States, people should not be walking around with masks. Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often, there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
So what changed? According to the BBC's Deborah Cullen on July 12th, she said, "We had been told by various sources World Health Organization committee reviewing the evidence had not backed masks, but they recommended them due to political lobbying. This point was put to World Health Organization, who did not deny." There's plenty of evidence that masks don't stop the spread of the virus. The Irish government were even informed of this by Professor Carl Hennigan when he addressed the Oireachtas Special Committee.
So in 2010, at the height of the last pandemic, there were 6 published trials on about 4,000 people. Since then, what we've done is not address the lack of evidence and close that gap. So in the intervening 10 years, there's been about another 6 trials. If you look at all them 12 trials together, what they show in healthcare professionals is that actually masks, gloves, combination of PPE reduces your risk of infection. When you go into the wider population, there's a small bit of evidence that if you have influenza in your household, a child, and you wear masks, at 1 week in the house, you can reduce your risk of influenza-like illness by about 10%. However, you have to completely adhere to the mask wearing for the whole week. If you stop adhering, as 50% of people did, you lose all of the effect. So that's one of the problems. The second issue then is the evidence that shows the comparison of cloth masks to surgical masks or the N95s shows clearly that cloth masks are worse and they may actually increase your risk of infection. Therefore, that's why they're not recommended in hospitals or in health professional settings. So what happens in these situations is of uncertainty, the opinion divides. I think masks are a good idea. I don't think I shouldn't wear them. And that's where we end up with people proposing more and more. They're saying put them on in schools, put them on in pubs, put them on in shops. But there's no clear evidence. They use observational data to inform their decision. Now, if you look at what's happened in the UK, for instance, we put masks in on 24th of July. They were supposed to reduce the risk of infection by 40% within the next 2 weeks. In fact, infections detected have gone up. So, in effect, people are not looking at the evidence. Now, when Norway looked at this, they looked at it and said at low circulation, the public health consequences are so minimal that actually it's not clear they work. And even if they did work, we reckon about 200,000 people would have to wear a mask fully for a week to prevent one infection. Now, that's how you have to think about the uncertainty. If you're going to put a policy in place, that's fine. What you can't do is say it's evidence-based, because when people talk about the evidence, they have again cherry-picked low-quality observational evidence to suit the argument. But they haven't picked then further observational. So, for instance, if you put masks in, what are you expecting to happen to the case definitions and the reductions in the next 2 to 4 weeks to show it was a worthwhile policy to enact? Thank you.
It would appear, at least, that health experts are receiving their guidance from the World Health Organization. So why has the World Health Organization instructed a change in this stance? Why are all nations of the world suddenly in lockstep with the same agenda? Well, not all nations. This article is on Armstrong Economics. Belarusian president claims IMF and World Bank offered him a bribe to impose COVID restrictions. Belarusian President Alexander Lukashenko said last month via Belarusian telegraph agency, Belta, that World Bank and the IMF offered him a bribe of $940 million in the form of a COVID relief aid. In exchange for $940 million, the World Bank and IMF demanded that the president of Belarus impose extreme lockdown on his people, force them to wear face masks, impose very strict curfews, impose a police state, crash the economy. Belarus President Alexander Lukashenko refused the offer and stated that he could not accept such an offer and would put his people above the needs of the IMF and World Bank. This is not a conspiracy. You may research this yourself. He actually said this. Now, IMF and World Bank are bailing out failing airlines with billions of dollars, and in exchange, they are forcing airline CEOs to implement very strict policies, such as forced face mask covers on everyone, including small children, whose health will suffer as a result of these policies. And if it is true for Belarus, then it is true for the rest of the world. The IMF and the World Bank want to crash every major economy with the intent of buying over every nation's infrastructure at cents on the dollar. If this is true, it would make an awful lot of sense, and it's the reason why I believe a colour revolution is being astroturfed in Belarus by globalists to remove Lukashenko. Look, you can call him a dictator if you want, but from where I'm standing, Belarus looks much more free than many of our so-called Western democracies. There is no way that the draconian control measures we're seeing being introduced around the world have anything to do with stopping a virus. COVID is an accelerant for the global communist regime that is the climate change agenda. This article is from the World Health Organization. World Health Organization Director General's opening remarks at the media briefing on COVID-19, 7th of September 2020. Today is the first International Day of Clean Air for Blue Skies. The pandemic and the measures taken in many countries to contain it have taken a heavy toll on lives, livelihoods, and economies, but there have also been some unexpected benefits. In many places, we have seen a significant drop in air pollution. It's almost like that was the intent of the lockdown and keeping people in their homes. Here's another article from them. World Health Organization Director General's opening remarks at the media briefing on COVID-19, 21st of August 2020. In particular, the pandemic has given new impetus to the need to accelerate efforts to respond to climate change. Why? How could they possibly be connected? Well, because COVID-19 is an excuse to bring about the climate change agenda. The pandemic has given us a glimpse of our world as it could be. Clearer skies and rivers. Are you starting to get it yet? Less people knocking around the world equals good, according to the World Health Organization. Building back better means building back greener. In May, World Health Organization published our manifesto for a healthy and green recovery. with 6 policy prescriptions for protecting nature, investing in water and sanitation, promoting healthy food systems, transitioning to renewable energy, building livable cities, the smart cities we're supposed to live in, the human habitat zones, because we're not going to be allowed to go to the rest of the country, and stopping subsidies on fossil fuels. In other words, they want to control the means of production, like communists tend to do. Economically, this will be achieved through what the World Economic Forum refers to as the Great Reset. You may have noticed the early signs of this in your local shops, from things like no longer taking cash, for example, all part of the cashless society because no cash means no freedom. But anyway, you can clearly see what's happening here. The lockdown was designed to let the globalists see what the world would look like if there was less people on the planet. Less people flying around in planes, less people traveling across the country, less people out on the streets. Maybe it was also about trying to see what the world would look like if there was simply less people in general in the world. Has the penny dropped yet? This is all ultimately Agenda 21, Agenda 2030, the Sustainable Development Goals project of the United Nations and the World Health Organization. The World Health Organization is, of course, an arm of the UN. Basically, the UN has enacted a global coup with this COVID-19 virus, and they got all member states to fall in line. It's a Trojan horse takeover achieved without firing a shot. Life as we knew it, the world over, was never supposed to go back to normal. Our politicians are puppets for the UN, the World Bank, IMF, the World Health Organization, and so forth, and they know what they're doing. They know that there's no reason to shut down meat processing plants because of suspected COVID cases while Amazon warehouses remain open. That's just about controlling the food supply. They know that the restrictions on pubs don't make sense. It's not about making sense. It's about crashing our economies and forcing humanity into extreme poverty, whereby we'll be much easier to control. Standard communist fare. When there's rules like people not being allowed to meet in groups larger than 6 people, or they face dispersal, fines, or arrest, it's just about control. It's about stopping peaceful protests and keeping people away from each other so that they can't coordinate, plan, and push back in unison against the government. It's to quell political dissent, nothing more. It has nothing to do with stopping a virus that's killing next to no one at this point. As Ivor Cummins has pointed out in his really great Twitter threads, and you should follow him over on Twitter, country after country is seeing a high number of cases, very low mortality. High number of cases, very low mortality. These lockdown restrictions and devastating economic and societal disruptions are not going to end until we stop all of this ridiculous amount of PCR testing and get back to our lives. More restrictions are inbound in the UK. There's talk of a 10 p.m. curfew, because apparently after 10 o'clock the virus just goes nuts, right? Whatever. Boris Johnson wants people to be tested daily. A passport to mingle if they are proved to be negative. In Quebec, Canada, Quebec City says it will isolate uncooperative citizens in secret corona facility. Health officials also visiting homes to take away people who violate quarantine. Victoria, Australia could very well be a taste of what the dystopian future may look like. Remember that pregnant woman who was arrested for posting on social media about an anti-lockdown protest? Well, she's facing up to 15 years in jail. Also in Melbourne, there was a woman out for a walk in a park. She is 38 weeks pregnant. This police officer wouldn't let her sit down at a park bench to catch her breath.
I just wanted to make sure I understand the rules. So, you're allowed to be in a park, but you can't sit in a park at all?
You can only be out of your house for one of the 4 reasons. That's one of those would be exercise. Sitting in a park is not one of the 4 reasons.
So she can walk in the park, but she's not allowed to sit at a park bench to catch her breath?
So I'm pregnant, and obviously my exercise is limited. Like, I don't know if because I have to walk, I'm now puffed out because I'm 38 weeks pregnant.
I understand.
So even I can't sit in a park. Is that right?
You can only be out for one of the 4 reasons.
So I just confirmed that. Yes or no? I can't sit in a park. As a pregnant woman, I cannot sit in a park.
You can only be out for one of the 4 reasons.
Just say yes or no. It's a yes or no question.
Have a good day.
You can only be out for one of the 4 reasons. You can only be out for one of the 4 reasons. This unfeeling drone is unable to say anything beyond his basic programming. And isn't it interesting how cruel and psychotic some police are becoming in Victoria now that they can cover their faces with masks? Australians, you're running out of time. This totalitarian cancer is going to spread beyond Victoria. Get it together down there. I recently talked about a health passport here in Ireland. The Health Passport Ireland, an app that keeps a record of your COVID test. If you test positive for COVID or your test expires, you can't go out and live your normal life. In order to be able to go to the shops, to work, on public transport, etc., you have to have an app on your phone that says you've got the all clear, basically. And it'll eventually record your vaccine status, because that's where all of this is headed. A mandatory vaccine that everyone on the planet has to take, or they will be cut off from society and unable to go beyond their front door. I made this video specifically to try to explain to people that wearing a mask, walking down the street, and thinking you're helping people is ridiculous, and it's appeasement, and you know it. Appeasement doesn't work. It's like wearing a yellow star, and we know from history where that ended. I get that you're afraid. There's no need to be afraid of the virus, but I do get that your fear came from a genuine place. You were afraid of this pandemic when it began. But it's okay to change your mind and realize that you were deceived. You're being played. No one likes to admit that they were suckered for months on end and that they lost contact with their friends and family. They may have lost their job and their business. And you have a right to be upset, confused, and angry, especially for those people who were denied access to be with their dying elderly relatives in care homes, and those people died alone without their loved ones around them. That was unnecessary and deeply cruel, just like the masking of children in schools is deeply cruel and abusive. And that is the critical point here. The people behind the climate change agenda, who are accelerating their plans with the COVID scam, are deeply cruel, evil, and psychotic people. They are obsessed with conversations like population control, in every sense of that term, by the way.
First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%.
Personally, I'm always wary of people who claim that the human population needs to be reduced in order to reduce our carbon emissions and save the planet from global warming, while simultaneously telling us that they want to save humanity from a virus no deadlier than a flu by coercing every human being on the planet to take a vaccine. It sure makes one wonder what will be in the vaccine, doesn't it? It's kind of like how they tell us that we need to lock down, destroy the economy, wear masks, and be socially distant in order to save the elderly, all the while there's growing talk in the mainstream media that assisted suicide and euthanasia of the elderly and sick should be legalized. It's almost as if the draconian COVID-19 restrictions and lockdowns are just about using the vulnerability of elderly people as an excuse to take everyone's individual human rights and freedoms away. No one ever asked elderly people if they want to be used in this way. They aren't even allowed to choose for themselves if they wish to take their chances and live their lives as normal. The fight against this scam is a fight for the freedom of humanity. And you are part of that fight. And you're not alone. Millions of people around the world have begun attending anti-lockdown protests like those taking place at Leinster House and Custom House Quay in Dublin on Saturday afternoon. Finally, I will say to doctors, nurses, politicians, and even celebrities with large influence, people who know what's going on but they're too afraid to blow the whistle and risk losing their jobs and career opportunities, please be aware, this situation is not going to simply pass, and you're not going to wake up someday and find that it was all a bad dream. There's no saving your own ass kind of thing. There's no economy or future employment that's going to be worth trying to scramble to preserve. Our opportunities in the future will be few and far between. We're all in this situation together. The only way to save your future and ensure your prosperity and the prosperity of your friends and family is to be brave and speak out now. Rest assured, doing so is not only the right and moral thing to do, it's vital to guarantee that your children and your grandchildren will continue to live in a free world. We need businesses, big and small, to stop complying with the absurd and deliberately destructive rules. They're designed to destroy the economy in order to bring about the Great Reset, a new economy that will usher in a neo-feudal society and the greatest transfer of wealth from the masses to the supremely wealthy 1% of the 1%. Only massive corporations and government-run businesses will survive. Your pub, hair salon, mom and pop shop, library, florist, whatever, your business won't exist by then, and that's exactly what they want. Once most businesses go under in the high streets of our cities, the property and retail units they were housed in will be bought by multinationals for pennies on the dime. Some will be taken by large corporate chains. Some of those units will be turned into high-density housing as part of a long-term plan to house more people in cities, human habitat zones. So, ultimately, our movement is about people power, and we can still win this if we work together. There is strength in numbers, and the elites know this. It's the reason they want to keep us socially distant and alone, because together, we're unstoppable. The clock is ticking. the pieces on the chessboard are moving, and it's now or never.